Hello, everyone. Today is Tuesday, July 27th. We're coming to you live on Facebook from our downtown location, what we call our Keeler location. It's at 251 North Bayou Street. I'm Rendy Murphy, an epidemiologist and the director of disease surveillance at the Mobile County Health Department. So today we're reporting on 46,662 total cases of COVID 19 in Mobile County residents. A whopping 493 cases were reported to us yesterday. Previously, when we saw a big jump like that, we might suspect that it was due to, a backlog of laboratory results that are processing. But at this point, we're not quite sure. It may just be a true number. So we'll take another look tomorrow. Again, 493 reported to us yesterday. That is a doozy. So far, the cumulative number of people admitted to Mobile County hospitals with COVID, 6,270. 24 of those were hospitalized yesterday. Yesterday in the hospital, we had 168 people in hospitals with a COVID-19 diagnosis. Just 14 days ago, that number was 49. So it is accelerating at a very concerning pace. The cumulative number of people who have died with COVID is 861. Four deaths were reported to us yesterday. When we do our weekly updated report next week, we'll get an idea about the date of death for those people, because remember, the daily increase in the number of people who have died or cases may not have necessarily occurred in the last 24 hours, but sometimes in previous weeks. I wanted to just give one piece of information. I'm not sure, don't remember if I shared this yesterday, but perhaps due to getting information out to local media outlets and national media outlets about the alarming rise in the number of COVID cases, we are seeing a surge of people at our clinics for COVID testing, and some more coming in for COVID vaccine. So when I look at an internal report that I get that shows the number of Mobile County residents who've received a dose of their first dose of vaccine, it had nearly doubled in 1 week. So last week, a little over 4,000 people got their first dose of a COVID vaccine, whereas the week before it was around 2,200. So not quite a doubling, but very close to it. So this is good news that maybe people who are on the fence about getting a safe and effective vaccine to protect them against COVID infection, against hospitalizations and death, maybe they are deciding to get vaccinated. Perhaps we're having sort of a last minute surge of students who are 12 and over, who are going to be going back to school in the next weeks and months, maybe deciding to get vaccinated. But we're happy to see that going up. Maybe we've been stuck on 30% of people fully vaccinated in Mobile County and around 35% of people having at least one dose in Mobile County. So we've been stuck there for quite a while. Perhaps this increase that we're seeing in uptake of vaccine will continue and maybe move us past that 30 or 35% mark. It would be really great if that could happen. All right, a little bit more about vaccines. Remember that anyone 12 and over can get a vaccination. It is state law that anyone 14 or older can consent to their own medical care. So, and some other things have changed about vaccination that people seem to be unaware of. You can get a COVID vaccine with another vaccine. So if you've gotten your back to school vaccines, or if you've gotten a shingles vaccine or a meningococcal vaccine, or MMR, whatever, you don't have to wait any longer to get your COVID vaccine at the same time. So you can get COVID vaccine in close proximity or on the same day as other vaccinations. So if you are a provider assisting children and parents with back to school vaccinations, please give them a COVID vaccine. If you are a pediatric clinic or if you serve children and you do not have any COVID vaccine because you couldn't store it or things like that, contact us, because the Pfizer vaccine that's approved for children at least 12 years of age can now be stored at refrigeration for up to a month. So we can, help some local clinics that have refrigeration storage but don't have ultra low cold storage. So let us know if you would like if you serve children and you would like to partner with us to get some Pfizer vaccine to store at room temperature and share with your pediatric cases. I mean, that actually is true for any clinic that wants to help us get vaccine out. So a little bit about some more myth busting about vaccines, and then I have quite a list here of questions. So we talked yesterday about, receiving a COVID vaccine will not cause you to be magnetic, that the COVID vaccine does not shed in your body. That is also a myth. If you are trying to become pregnant, you can still get vaccinated. That COVID-19 vaccine does not affect male or female fertility. So the next one we'll talk about is, will a COVID-19 vaccine alter my DNA? Equivocally, no. COVID-19 vaccines don't change or interact with your DNA in any way. Both the mRNA vaccines, which is Pfizer and Moderna, and the viral vector vaccine, which is J&J, they deliver instructions, so genetic material that tell our cells to start building protection against the virus that causes COVID-19. But the material never enters the nucleus of the cell, which is where our DNA is kept. So maybe break out your science books from high school and look at the makeup of the cell. So again, the vaccine causes our body, our immune system to react. It does not go into the nucleus and alter our own DNA. All right, will getting a COVID-19 vaccine cause me to test positive on a COVID-19 viral test? No. None of the vaccines cause you to test positive on the virus tests, which tell you if you have a current infection, right? So a viral test lets you know if you have a current infection. So the vaccine will not interfere with a viral test result. You will not test positive simply because you got vaccinated. If you get vaccinated and your body develops an immune response, which is exactly what we want to happen, you may test positive on some antibody tests. This is different from the viral test. Antibody tests indicate that you had a previous infection, or that you have some level of protection against the virus. So you will not test positive on a viral test just because you've been vaccinated. So we'll save a couple of these last ones for discussion tomorrow or maybe Thursday. All right, so let me answer a question from NBC 15. So they're asking, is the Mobile County Health Department, the state health department, the federal agencies, are we tracking what type of hospitalizations are occurring, how many beds are available, how many people are in the ICU, that sort of thing? The answer is yes. The Alabama Incident Management System is the system we have used since March of last year, and actually before that. The system was in place long before COVID. The hospitals enter daily information on their bed status, on their supply status, on their staffing status, and we monitor those that information on a regular basis. When I looked at that today, I think this is what people really are looking to know. We do have pretty full ICUs. So only about 4% of the ICU beds in Mobile County are available. I think what's a little bit more alarming is that 14% of our NICU beds are available. So this is the neonatal, ICU beds. And then the about 17% of the ED beds are available. The good news is we have 60% of ventilators available. So while we are, with 168 people in the hospital with COVID, and then all of the other hospitalizations that are required or that are needed out there, we are getting low, particularly on intensive care unit, those ICU beds, and the neonatal intensive care units, the NICU beds. But our hospitals are very adaptable, and they can adapt and move people around and move things around and move beds around to try to adapt. They did a great job of doing so last December and January when we saw our highest peak of the pandemic so far, although I am concerned that this peak that we're entering now will probably be larger than what we saw in December and January. It's looking very much worse than what we had in the winter.
We have one media question.
Okay. So Mark has a question from someone on Facebook that he's going to ask me.
With the new CDC guidelines recommending all children vaccinated and unvaccinated wear masks, will you be re-evaluating recommendations for schools locally?
So the recommendations for school locally have not changed. We follow the CDC recommendations that in the K through 12 setting, any unvaccinated person, be it a parent, a child, a worker, a faculty member, a visitor, anyone in the schools who is not fully vaccinated should wear a mask when indoors. That is our strong recommendation. Okay, so then there's a big old long list of questions here. Let's see. What are the chances of getting COVID after being vaccinated? Well, depends on what product you get and how well your immune system reacts to vaccination. But when we look at large numbers of people who are vaccinated, about 95% of those people do not get an infection. So that means that you've got a 5 in 100 chance of getting COVID after you've been vaccinated. But that is for everybody. Your risk of getting COVID after vaccinated goes up if you have an immunocompromising condition, or if you have underlying medical conditions, or if you're not layering other prevention measures when you are in populations of people with unknown vaccine status. And again, we have a really high rate of transmission going on right now, so that puts everybody at greater risk. All right, here's next. Can the MCHD dashboard be updated to include breakthrough cases? And this word breakthrough is being thrown around a lot, but I've already said that we expect 5% of people who are vaccinated will get COVID. So it's not a surprise. And we have looked at some of this data internally with the state health department. We have requested that they make it available to the public. They have not done that yet, to my knowledge. As soon as the state health department says it's okay to share it externally, we will do that. What I would like for people to remember is that we have many more reinfections than we have infections in fully vaccinated people. So people are not immune just because they had COVID. They have about 90 days of protection, but we've been going on about this 18 months, right? So it's possible for someone who had COVID and never got vaccinated to get COVID again, to get COVID a third time, to get COVID a fourth time potentially, if they never get vaccinated. So reinfections are also something that we look very closely at. And in general, for every one COVID case in a fully vaccinated person, we see about 4 reinfections. So just want to bust that myth that having COVID last year or a couple of months ago does not protect you from getting COVID again, and it is not a replacement for vaccination. All right, next. How do how do we protect children under 12 from COVID if someone tests positive and lives in the same home? So this we have to rely on the same measures that we relied on before we had a vaccine. So last year, this time, we were telling people if you have someone in your household with COVID, they need to isolate, a different room, don't take meals together, use a different bathroom if you can. These are still the things that need to be in place for households that have unvaccinated residents, whether they're less than 12 and not eligible for vaccine, or if maybe they just elected not to get the vaccine. So again, we have to think of this layered approach. Vaccine is our very best layer, right? Get vaccinated. Then there's mask wearing. Then there's distancing. Then there's staying at home with when you're sick. Then there's washing hands, increasing ventilation, disinfecting surfaces. All of these things that we've been talking about last year are still in play when you have a household where not everyone can be vaccinated and somebody has COVID. However, this year, what's different from last year is Delta. So it is unlikely that you'll be able to have someone, infectious in your household and keep it from spreading to people who are vulnerable. So what we're seeing is that more than we saw last year, if someone gets COVID, everybody in the household gets COVID unless they've been vaccinated. All right, here's a question about how many caught COVID a second time. The last time I saw a number on that, it was getting close to about 5,000 people. How many fully vaccinated caught COVID? The last time I saw that number statewide, it was around 1,800. Here's an interesting one. It says, did MCHD use pool testing? I think what the question is supposed to be pooled, P-O-O-L-E-D, not P-O-O-L. So we do test pools when we're inspecting pools, but in the context of COVID, I think what this question about is what's called pooled testing. It's where rather than testing an individual specimen, right, several or maybe 10 specimens get tested together. This is similar to what the Red Cross does when testing blood donors, right? They'll sort of pool the testing so that they can get the cost down. And then if they get a pool of 10 that test positive, then they'll go looking in those 10 individuals to see who it was that had COVID or who it was that, had some, you may still be able to donate blood if you get COVID. I'm suggesting that you can't, but pooled testing is when you take a group of people and test them all together, and then if it is positive, then you test them individually to determine which person had COVID. We have not done pooled testing. The health department has not done pooled testing. There's been a lot of talk about pooled testing with schools. Again, it's an effort to try to get the volume high and the cost low. All right, here's a question. Can cancer patients get the vaccine? Yes. Should they talk to their oncologist? Yes, but you should get the vaccine even if you are under treatment for cancer, but talk to your oncologist. Here's a question. If the vaccine is safe, then why has the status not changed from emergency use to FDA approved? This is a really good question. We ask CDC and FDA this ourselves all the time. It's like, come on, get a load on. We're hearing that they are, looking at the efficacy data, how effective the vaccine is, and really, looking at the safety data to determine if they will be able to grant full FDA approval. But it's a lengthier process than granting emergency use authorization. As you might have remembered from back in the fall when we were talking about this, you could submit data and then a week or two later FDA would meet, and then another week and another week. But the approval process takes generally 4 to 10 months. It has started. We're hoping that they will expedite the approval process but no word yet on when we might expect full FDA approval of any of the three vaccines. All right, here's a good one. I'm glad that people ask me. Do fully vaccinated people have to quarantine if they test positive? If you test positive, you need to go home. So, yes, if you are fully vaccinated and you test positive for virus in your respiratory symptom, you are infectious and you need to go home and stay there for at least 10 days. So being fully vaccinated does not exempt you from isolation if you get COVID. It only exempts you from quarantine if you are exposed to someone with COVID. Subtle difference, and lots of people seem to be getting a little confused about that. And then lastly, if I'm fully vaccinated, should I be wearing a mask out in public? Currently, CDC recommendations are pretty clear on this, that if you are fully vaccinated, you can return to normal duties, particularly if you are outside. That if you're outside and you're fully vaccinated, there's no need to wear a mask. For fully vaccinated people and you're indoors, you shouldn't need to wear a mask. But there's this big, note at the bottom with a couple of asterisks that says local authorities, based on local situations, people may want to take a different approach. So, in this situation that we have in Mobile County, with more than 20% of the COVID tests being positive for COVID, super low vaccination rates, particularly in people 18 to 49, I do think that fully vaccinated people who have underlying medical conditions or have immunosuppressive conditions, I think they should consider wearing a mask indoors, especially if indoors they are around people with unknown vaccination status. So again, it's about making a good decision for yourself based on your vaccine status, your underlying health conditions, and what's going on in our community. Being aware that we have nearly an uncontrolled outbreak right now going on in Mobile County. Until we can get our vaccination rates up, we're going to have very little chance at slowing the outbreak. So it is likely going to get a lot worse before it gets better. So take control of your health and of your family's health by layering on protections against COVID, particularly that the Delta variant is so contagious and that so few people are vaccinated in that 18 to 49 age group. And let me just say, for everyone out there who is 65 and older, thank you. Thank you for doing your part and getting people 65 and over, more than 70% of you fully vaccinated. I'm just so thankful that you heard us and that you are doing everything that you can do to protect your community. I hear many of you that are frustrated that your children or grandchildren have not been vaccinated, and that's very frustrating to you. So again, I hear you. I thank you for doing your part, and please don't give up having the conversations with your family to try to get them to take a perfectly safe and effective vaccine. So I will stop there. Okay, any questions that came in today, we'll roll them over till tomorrow, and we'll see you then. Be safe, everyone.